After I left government, I founded several businesses, including, as you mentioned, an applied analytics firm. That firm was very successful in developing predictive analytics and other models based on what I would call more of a social science than pure data science perspective. We ended up selling that firm to a much larger data analytics firm in Washington, D.C. And that's actually what brought me out to Santa Barbara, California. As a result of all that work, I'm very familiar with leading modeling techniques, machine learning tools, and things of that nature. And when I had my applied analytics firm, I had the good fortune of being surrounded by PhDs in data science, operations research, statistics, and political science. So when the models called for it, we could do the heavy math and computer efforts that were required to build the right kind of models.
Cool. Well, before we get into the modeling, can you tell us about what data the government is reporting and what it represents? Several of our readers have been asking about that.
Yeah, I think it's important to set the ground here for this discussion. So as of about March 31st, the government has been reporting, the state of California has been reporting several important statistics. I think the one that everyone is most familiar with is confirmed cases. These are people who have tested positive for the coronavirus. More importantly for our discussion today, on March 31st, the state started reporting hospitalization data, both hospital beds required for confirmed COVID-19 patients, as well as the beds required for those who are suspected to be suffering from the virus. And lastly, they report fatalities, as you know, and we can calculate daily changes in these statistics based on the government's reporting. I think for me, to start this conversation, the most important thing I'd like your readers to know is that they should be following the hospitalization and fatality data most carefully. That's the data that's going to tell us what's happening with the virus.
Sorry, we seem to be having some technical difficulties, mainly because I'm a moron. I think I forgot to click a link. I apologize for that. And now I need to take a moment to read some stuff and figure out what I'm doing wrong. So bear with me. I apologize for that. We'll come right back to this.
Susie said we're not live.
Yeah, I'm getting that as well. Oh, now I'm told we are live. Apparently there's no record of the tremendous, well-written, well-spoken introduction that I gave. Yikes. We'll figure out what's going on there, and maybe I have to restart that.
We are in fact live now, so we might want to go back to the beginning.
Can we just start over? Probably. Yes, Kim Clark is telling me we should start over. Okay. All right, I'm going to start over. For the second time, welcome to our inaugural Noozhawk Talks. I'm Bill Macfadyen, the founder and publisher of Noozhawk, Santa Barbara County's leading source of local news. And our guest today is my friend Brian Goebel, a public policy expert, founder of a successful applied analytics company, editor-in-chief of the nonpartisan Santa Barbara-based 2040 Matters public policy blog, an elected Montecito Water District board member, and a Noozhawk contributing writer whose COVID-19 columns have been blowing up our website. I'm here at Noozhawk World Headquarters on Hitchcock Way in Santa Barbara, and Brian's hunkered down in his home office in Montecito. I need to apologize because we had technical difficulties at the beginning here. I apparently forgot to click a link, and so we didn't get started, or we got started on time, but we didn't get started for you on time, and I apologize for that. So we're backing up and starting over, and we should get back on track really quickly. This webcast, as you already know, is a first for Noozhawk. We've long wanted to do one, but we've struggled to identify the right issue for the format. boy, did we find it with the coronavirus, or maybe it found us. We believe this format or a variation of it can be a vital civic engagement tool at a time when we need it most. We want to hear from you about this process, how you think we can improve it, maybe get some professional help here, and what you want us to tackle next. Email us at news@noozhawk.com or leave your comments on our Facebook page. We've already received dozens of your questions, which is both exciting and gratifying, and all of them are excellent questions. If we can't get to them all, and I'm telling you right now, we won't be able to, and some of them may be more appropriate for a different conversation or a follow-up news story, please know that we'll figure out a way to address them, and we'll let you know when and where we do. As you all are painfully aware, since it was triggered last year in Wuhan, China, this pandemic has sickened millions, killed thousands, and devastated economies around the globe. Here at home, we've reached record unemployment levels in a matter of days and imposed draconian restrictions that are unprecedented in our republic. There's even an apparent shortage of toilet paper. Of course, as you know we always do, Noozhawk has leaped into the coverage as best we can with a small team. But when you're trying to drink from a fire hose of information coming at you, it can be difficult to step back and spend some quality time assessing the situation and circumstances behind the news. In the case of the coronavirus, the data analysis and modeling have been particularly challenging. Let's face it, it's a complex subject with a multitude of variables. On top of that, there's not really a single standard that everybody points to and says, that's the one. And on top of that, public health officials and epidemiologists are also trying to drink from the fire hose of information in the middle of a very fast-moving wildfire. The data sources themselves are often erratic and incomplete. That's why we're so grateful to Brian for bringing clarity to the situation using reasoned research and lay terms. His columns have covered a data interpretation primer, explained a key comparison to Italy, explored a variety of modeling forecasts and assessments of the COVID-19 trajectory, and assessed their accuracy. What's more, as a result of his own accuracy and transparency, he has earned the trust of our readers. His April 5 column on California's flattening curve was read more than 170,000 times, making it the most read article in Noozhawk's 12-and-a-half-year history. I'm the most read columnist on Noozhawk, so I've really got to step up my game. Today, you're going to hear Brian's insights into the methodology and the analytics that make up pandemic modeling and where we are today, statewide and locally. But we're also going to talk about our next steps and goals and how you can help us accomplish them. So Brian, I didn't give you nearly enough credit. Will you explain a little more about your policy and modeling background? What makes you qualified to do this?
Thanks, Bill. And I will get to that in just one second. But before we dive into the modeling, I just want to thank you and Noozhawk for your intensive coverage of this crisis. Like you, I'm a huge proponent of civic engagement, and you guys have been leading the way in our community, and we should all be thankful for that. Secondly, I would be remiss if I did not thank our healthcare professionals in Santa Barbara County for the incredible work that they're doing to meet the challenges that this unprecedented pandemic has posed for our community. I'm very grateful for everything they've done throughout this process. My background, if you'll bear with me for just 1 minute, I started my professional career as a lawyer at Gibson, Dunn & Crutcher, both in Los Angeles and Washington, D.C. From there, I was drafted into the Treasury Department immediately after 9/11. My first day on the job was September 13th, actually, 2001. And the policy portfolio I had at Treasury and ultimately the Department of Homeland Security included overseeing the border security efforts related to data collection and analysis. And it was through that work that I started drinking through the fire hose of machine learning, modeling, statistics, and everything else that I now take for granted in my knowledge bank. But it was a crazy, absolutely crazy time. But it started my work in this area. From there, when I left government service, I founded a series of professional services firms, including, as you mentioned, an applied analytics firm. We developed a proprietary social science-based modeling methodology to answer some pretty difficult questions for our government and financial institution clients. I ultimately sold that firm to a much larger data analytics firm in the Washington, D.C. area, that's now owned by the Carlyle Group. When I was there, I had the good fortune of working with an incredibly talented team of data scientists, computer scientists, political scientists, and operations researchers to build models. And then candidly, when we got to the point where the math became beyond my capabilities, handed over to them to do the heavy lifting, and they did an amazing job. And since then, I've paid attention to these issues and these trends, and I'm sure we're going to talk more about that over the next 45 minutes or so.
Yeah, we are. But before we get into that modeling, can you tell us about what data the government is reporting and what it represents? Several of our readers have been asking about that.
Yeah, so the California Department of Public Health reports the official statistics for California. They do a daily press release, roughly about 5 p.m. Every afternoon. They are now tracking a set of statistics that includes the following. First would be confirmed cases. These are people who've tested positive for the coronavirus in California. That's the statistic that gets the most media attention typically. Most importantly, as we'll discuss, since March 31st, they've been tracking hospitalizations, both beds, regular beds, if you will, and ICU beds. And they track hospitalizations in two different categories. One, confirmed COVID-19 patients, the other suspected COVID-19 patients. These are people who are experiencing COVID-19 symptoms, but have not yet been tested positive for the virus. And then lastly, they do report daily fatalities as those come in. And as anyone who's been reading my columns knows, but I'll reiterate for the purposes of this discussion, the most important data to watch in terms of assessing the trajectory of the virus in California is the hospitalization data and the fatality data.
And how does the reporting lag on each of those elements?
Well, you hit it right on the head, Bill. Most important thing to recognize is that they're all trailing indicators of what's going on with the virus in California. So anytime you see a statistic reported today, you need to recognize that that reflects the state of the virus several days before. So we're catching up. Sort of, not really, but you get the idea. We're looking back in time. So the confirmed cases, the progression of the virus, the typical onset of symptoms occurs between 4 and 11 days after exposure, infection. So that means you could be tested 4 to 11 days in. It takes 4 days to 5 days in some cases to get test results returned. So I think most of the testing reflects infections that likely occurred 9 to 15 days ago. That's a good range to be working with. Mm-hmm. Hospitalizations is very similar. We're looking back at time. The progression in the virus is that most people who require hospitalization get there between 5 and 12 days. Mm-hmm. And so those numbers then trail, get reported. And so we're looking back at people who were infected 5 to 12 days ago when we see their hospitalization data. And then not to be too grim about this, but the fatality data trails that by about another 10 to 13 days. So you're hospitalized, you then go through the progression from hospitalization to intensive care. In some cases, unfortunately, people are dying from the virus. So when we see fatality data, that can reflect infections that occurred 15 to 25 days ago.
Right.
It lags considerably.
Thank you. Quite a few of our readers want to know what data you use for your models and analyses. As reader Rick Roney asks, how complex is your COVID-19 model? How many variables does it contain?
Yeah, so those are great questions, and I could probably spend the entire interview going through each and every part of that question and how I respond to it. But let me talk about this at a high level. First, my models, as I started building them, were designed to predict hospitalizations, hospital bed capacity, that sort of thing. So I use hospitalization data to track the performance of my models, and I publish those curves on the blog. In terms of preparing the models at a very high level, I did a substantial amount of research into the epidemiological literature and reporting from the CDC on the virus characteristics, its progression, spread rates, and the things like that, including the likely impacts of social distancing measures in terms of curbing the progression of the virus. I then looked at fatality data and hospitalization data in California. It was reported primarily by a handful of county public health departments, but there was some initial reporting that was useful. I also look a lot at the data coming out of Italy, and I'm sure we'll talk about that later, because Italy and California started their COVID-19 trajectories basically at the same time and are on very different paths. And then lastly, I considered in my forecasting some of the unique demographics of California, particularly our younger, healthy population, and the fact that we have some of the lowest smoking rates, not only in the United States, but in the world. And I thought those were important factors to try to take into account when modeling California specifically.
I completely agree. Totally agree.
And then,
sorry.
No, I was just going to say one other thing, because someone asked about how many variables and things like that were in the model, and I don't want to forget that question. So I built a very simple mathematical model to predict the trajectory of the virus. It's not overly complicated, to say the least. And the reason I did that is because there's a principle in philosophy known as Occam's razor. And that loosely translates as the simplest explanation is usually the correct one. And here I thought that was almost certainly true when you looked at modeling and how to think about the trajectory of the virus in California. So the model is not overly complex, to be candid, but I didn't think it needed to be.
Sure, of course. So what triggered you? Why did you start doing this? Was it when Major League Baseball suspended spring training?
Oh man, do I miss baseball. My son plays at Carpinteria High School, Bill, as you know, and I'm also a sabermetrics nerd. So if I weren't doing COVID-19 data dives, I'd probably be doing my next baseball analytics paper and trying to get it published like ones I've done in the past.
Poor kid had the shortest season on record.
Yeah, 5 games. Yeah, it's unfortunate for him and all the other high school athletes who lost especially the seniors who lost their final year of high school sports. But that's not why I chose to dig in on COVID-19. Like we discussed earlier, I'm a huge proponent of civic engagement and an informed public. And I thought it was important to get involved on this question after the governor announced the indefinite stay-at-home order on March 19th. I really began modeling to answer 2 questions, which was the governor right that we needed 50,000 beds or more to withstand the initial onslaught of the virus? And was he right that the only way to meet this requirement was through the extraordinary, unprecedented stay-at-home order that he issued on March 19th? To be candid, as you can tell from my writings, I had my doubts about both of those. And so I began working on a model roughly about March 22nd to try to answer both of those questions. And if you'd like, I'm happy to go into what those initial findings were.
Now, all of your columns are available on Noozhawk. We don't permanently archive and disappear anything. So if you go to Noozhawk and just search for Brian Goebel, or even just Brian, they'll all come up.
So then with that, Bill, let me just make 2 observations on my initial modeling, and we'll keep this going. So one is, I want to be clear on this. If the state had done nothing and the virus were spreading in an uncontrolled manner, we would have exhausted our healthcare capacity. I'm convinced of that. So do nothing throughout this process was not an option. And let me be entirely clear about that. But I ran a bunch of scenarios that were short of the stay-at-home order, and none of them required more than 17,000 beds. And the model that I like the best, the one that I published is my 1.0, predicted we need about 6,300 beds, and that the hospitalization peak would occur about April 6th.
Brian, we seem to run into some garble.
Okay.
I think you might need to repeat that answer. Sorry.
Zoom and technology. Yeah. Okay.
It's probably me.
Let me go back and just say that my initial modeling showed a couple things that I think everyone should be aware of. First, do nothing was not an option for California in combating the coronavirus. It's very clear from my modeling that had the state simply let the virus run its course, we would have overwhelmed our healthcare system. So we had to do something. The second key finding was that we probably didn't need 20,000 beds in order to withstand the initial initial part of the pandemic. I concluded we needed no more than about 17,000. And the model that I thought performed the best predicted we would need about 6,300 beds at the peak, and that peak would occur roughly on April 3rd to April 6th.
Mm-hmm. Okay, and then you that column went up on March 26th, I believe.
I think that's right.
So how does your model compare to California's official model?
Well, this is going to sound a little flip, but mine is more accurate. That much I know. The rest of this answer is I'm not sure, quite frankly, Bill, because the state has repeatedly refused to publish its model. I've called for that. Several leading epidemiologists at Stanford, I believe, and Cal Berkeley have called for that because it's important to understand what's in the model and subject it to peer review. But that simply has not been done. So I can't do an apples to apples comparison on the two models.
All right, well, we'll follow up on that. As of last night, though, the state is reporting roughly 5,200 total hospitalizations, and the number of new the number of new hospitalizations each day is on a downward trajectory, as you have been forecasting. So it looks like we're going to come in slightly under your initial prediction for the number of beds required, but a bit above your prediction in models 3.0 and 3.1. How did you predict this so accurately while other models were overstating the spread of the coronavirus and the statewide demand for beds, for that matter?
So that's a great question. And I think that it starts with sort of the social science perspective that I have on modeling and how you frame modeling projects before you get to the math. And so for me, modeling starts with essentially a deep dive into the context. Here, that would include obviously learning as much as possible about the transmission of the coronavirus and social distancing responses and how they impact viral spreads. It also is important to understand what question you're trying to answer. In my case, I was looking specifically at healthcare capacity. And then from there, you've got to apply logic and critical reasoning to begin sorting out what key components of a model are going to look like and what data sources you need to put in the data, the math, if you will, and that's going to be the core component of your model. The data process, the data selection and population process is often the most critical in modeling. And if you make bad choices there, it's going to affect the performance of your model. You might pick data from another jurisdiction that's actually not analogous, and that could affect the performance of your model. You may make assumptions about how to fill in those data gaps that aren't actually defended by the best available data. And it's not until you have all of that done, quite frankly, that you turn on math. And so that's the process that I followed here. And I think that explains some of the reasons why my models have performed like they have.
Okay, well, let's just say for the record that I understand that. But can you tell us why the accuracy of your models has distinguished them from those cited by the news media and public health departments around the country or around the state?
Yeah, so if I had to make two observations, I think explain a lot of the differences, it would be these two. So one, I started with an assumption that the spread of the virus in California long before March 19th had been slowed. Didn't mean it had been stopped, but it was slow. It was not behaving as an uncontrolled virus like we were seeing in Italy, for example, which had its first confirmed case at basically the same time that California did. So I never thought the virus was actually out of control by the time we got to the March 19th stay-at-home order. And I think if you start with a very high number in your modeling, you're going to get a very large number at the end of your model, right, in terms of viral spread in cases and hospitalizations. And I didn't, by comparison. Secondly, and I think this is probably my signature insight into the modeling effort in California, is it's important to conceive of the virus spread in three distinct ways. And I've talked about this in my post, but I'm going to review them really quickly here. So wave one is essentially the period before March 9th, when California was aware of the threat posed by the coronavirus and was taking what I would call public hygiene and initial social distancing measures to get on top of it and prevent the spread. We had the cruise ship incident. We had a lot of media attention on the virus. People were paying attention early, and I think that made a huge difference.
Mm-hmm.
Secondly, what's been lost in a lot of the media reporting is that we were experimenting at the local level and the state level on social distancing measures from March 9th to March 19th.
Sure.
Santa Clara led the way. There were state actions taken. Our county was doing things. All the counties were doing things, and they were escalating rapidly in response to the data. I thought that was having a significant impact on the spread of the virus, and that wave needed to be modeled separately and teased out of the data. Third, there's of course the stay-at-home order issued on March 19th, really taking effect on March 20th. And so for me, predicting the trajectory of the virus depended on essentially thinking carefully about each of those three waves and what was likely happening in each of those waves as we move forward in time.
Okay. Why have you kept modeling since version 1.0, which was weeks ago now? It seems
so my wife,
like years ago, but just recently.
So my wife has been asking me the same question as I've been banging away on my keyboard and everything else over the last 2 weeks. But in all seriousness, I thought it was important to keep the modeling going because these are unprecedented times.
Mm-hmm.
The public policy challenges here are enormous. And I thought it was important to put the best available information in the public domain so that our policymakers could begin reacting to it. And quite frankly, the modelers who are actually doing work for the state could begin reacting to it. Secondly, as I've discussed and has been repeated in the media quite a bit, models are meant to be iterative.
Mm-hmm.
You really shouldn't just build one and stop, especially in the middle of a pandemic, and especially when the data I had available to me on March 22nd was very different than the data I had available to me by March 30th in terms of
Sure.
defining the numbers that I was using internally in my model. And of course, we had the Italy experience to learn from as well all through this time. We're trailing Italy by about 10 days, and we can incorporate that into the modeling. So I started on that. I built my second model and then had it rendered obsolete when the state changed its data reporting structure on March 31st.
Yeah.
So I had to go back and build my third model to conform to the state's data reporting. And then the state finally cleared its massive testing backlog, which I'd written about in my very first model. So I could finally calculate the lag correctly, almost correctly. So I had to build model 3.1, but I'm done. Thankfully, I'm done. I'm not going to build another one. I think those are the reasons why I kept going. But the reason why I started is probably most important, which is I don't think we had any objective measures or metrics in place on March 19th or 20th for measuring the success of the stay-at-home order. And given the extraordinary use of state power that lies at the sort of foundation of that state order, I thought it was important that we develop some kind of objective measure so we could assess its success or failure publicly and objectively. And so that's why I've kept going for the last few weeks.
Yeah, well, thank you. I agree. So Dr. Anthony Fauci, who's the director of the National Institute of Allergy and Infectious Diseases, and is probably the most well-known face of the coronavirus battle, he now says that the models change every day with new inputs, i.e. reported cases and so forth. Do you believe the government could have done a better job updating its models?
Yes,
I guess that's a loaded question.
Yeah. Yeah, surprisingly, I have an answer for that. So yeah, the answer is, of course, I think it could have done better. And I've talked about this over the last couple of weeks. So it started with the point I made earlier that the government didn't publish its model and didn't subject it to peer review. And this has been a critique that, as I said, leading epidemiologists have been making over the last several weeks as well. And modeling is as good in some cases as the peer review that it goes through. And here, not very clear that any meaningful peer review was done, let me put it that way. Secondly, the government didn't even roll out the statistics we need to measure the effectiveness of the stay-at-home order until March 31st, so 12 days after the announcement. And then it didn't make it easy for us to calculate the effectiveness of the stay-at-home order. I actually have to do all that math on the side once I input the statistics that the California, government officially releases. About a week ago, there was this popular talking point in a lot of the public health and media circles that there was this sort of sneaker wave coming. I didn't see any support for that in the data, and there was, of course, no data cited to support that position. I thought that was problematic. And then just last week, the state said they needed at least 2 more weeks of data before they could really draw conclusions about the effectiveness of the stay-at-home order. And that's what prompted me to write my last post on this, because that's simply not correct given the clear trajectory in the data that's available to us now over the last 11 days, quite frankly. So this could have and should have been done much better from the beginning. There's no question.
Where are we today in California?
So this is a good news story. We have been exceptional in California. California is an exceptional place, and in this case, we're no exception, right, to our own exceptionalism. Hospitalizations are way down. They've been coming down dramatically over the last 11 days. And it's pretty clear that we've peaked and we're now reclaiming our hospital capacity. We had more discharges than admissions on April 10th, for example. So the trend line here is incredibly positive, and people should be enormously proud of the sacrifices they've made over the last 3 weeks. It has worked, quite frankly, at a level that I think no one predicted. I certainly didn't predict this level of deceleration, if you will, in the coronavirus. It's been tremendous. Secondly, I think fatalities have likely peaked over the last 4 days. This would make sense based on my assessment of lag time in the reporting. We'll know for sure over the next few days, but I think that's going to tell a good news story as well. And so I'm very confident, Bill, to borrow the governor's vocabulary here, that we've more than met the moment. We've done it, and California should be enormously proud.
Yeah, I think, for the most part, people have, widely adapted to that and embraced it. And of course, it can't be said enough that the frontline healthcare providers have been an enormous, have done an enormous job in successfully controlling this too. We couldn't have done that without them. They go hand in hand, but we've helped them in that regard. But what they've been doing inside the hospitals is just fantastic. So yeah, good on all of us. But that does raise an interesting question, given that Washington State was the first state to, I guess, have identify a coronavirus patient, in California being closer to China than the East Coast. But what are some of the reasons for the differences between California and Washington versus New York City and the East Coast?
So that's a great question, and I suspect that's one that the epidemiologists are going to be researching and writing about for the next several years. Personally, and I would defer to them on this, but I'm confident that demographics and population density are going to explain a lot of the differences between the West Coast and the East Coast. But I also think that you're going to see a significant difference shine through in the policy choices that were made on the West Coast versus the East Coast, in the sense that I think we were desensitized to the presence of the virus and its significance at an earlier point in time than a lot of other parts of the country. As I talked about earlier, we were already on the wash your hands, don't shake hands bandwagon long before a lot of other parts of the country had really come to grips with the significance of the pandemic.
Right.
And that just carried through into those early responses at the local level and the state level. And so we got on top of this collectively a lot earlier, I think, than the East Coast. And so, if you use the analogy of a snowball rolling downhill, right, gathering steam, getting bigger and bigger, we try to jump on the back and slow it down at the top of the mountain. I think a lot of the East Coast communities, quite frankly, it was about halfway down when they tried to put the brakes on. And that's really difficult to do because the spread of the virus by that point had reached very significant levels, and it was going to take extraordinary measures to bring it back down.
So in other words, what you're saying is the West Coast finally gets its revenge for that East Coast bias in the national media. But what about Santa Barbara County?
So Santa Barbara County is a good news story too. It's been a good news story really since the inception of the pandemic. Our hospitalization rate has been low and it's been steady. We are not experiencing exponential growth in hospitalizations or ICU demand at this point, and I don't see any reason why that would change. We've had an extraordinarily good response to the virus, and probably the best metric on that is actually the fact we've only had 2 fatalities in Santa Barbara County, which I think those are tragedies, don't get me wrong, but that's a pretty astounding position to be in given the stage of the pandemic that we're in.
Yes, I totally agree. Sort of along those same lines, one of our readers, Lorna Robles, wants to know how big a factor the U.S. penitentiary in Lompoc has been in the total number of cases in the North County.
Yeah, so the federal prison in Lompoc is an important ingredient in our overall county reporting. There's no question. Right now, the cases coming out of the penitentiary account for about 25% of the county's hospitalizations. So it's a very significant contribution to our overall reporting. And I think that going forward, it will be important to look at these numbers separately from what's happening in the rest of the county.
Right. A lot of our readers have been asking, how does this end? One of our readers asked if a vaccine is the only way to stop the virus. I know you're not a medical doctor,
but thank you for that caveat. But I have done a lot of reading on this and thinking about this issue. So I think to get back to the sort of phases idea, we need to conceive of the virus as having sort of 3 phases in our community. Phase 1, we just got through. We've bent the curve. We met the initial onslaught, if you will, and brought the virus down to levels well below what I think anyone expected, as we were discussing, in terms of its impact on our community. So phase 2 is what I would call living with the virus. It's the new normal, and we're transitioning there, I hope, fairly soon. And what that's going to look like, and I want to be very clear on this, phase 2, the new normal, the transition phase, whatever label we want to put on it, does not mean we go back to the way things were last December. Doesn't even mean we go back to the way things were on February 15th.
Yeah.
To the contrary, we have to devise a set of public health measures that are less disruptive to our normal lives than the current stay-at-home order, but are reasonably and well-calculated, tailored measures that are going to keep the spread of the virus to a level that our healthcare system can absorb and sustain without overwhelming our healthcare professionals.
Right.
And fundamentally returning to we are not going to return to a rate of spread like we saw even in California in the early days of the pandemic. So that's what I would call phase 2. And that phase is going to be with us for quite a while. We're going to live with the virus. And I think that phase can be shortened by really 2 developments that are in the news a lot right now. One would be the arrival of therapeutics, medicines that actually minimize the symptoms, the severity of those symptoms, the length of hospitalizations, and improve outcomes from healthcare. If we reduce fatalities through therapeutics, I think that will have an amazing impact on our communities, because people will begin to look at the coronavirus as more of a flu-like virus than something catastrophic like Ebola, and will change the collective psyche in a way that's very positive. That's if we get those therapeutics. The other, as your readers may know, because you guys reported on this morning, is that we have testing going on in California right now, primarily in Santa Clara and Los Angeles, designed to look for the coronavirus antibodies. And that testing will document how many people have already been exposed to the virus by assessing the antibodies in their blood. And if it turns out, and I do not know this, I'm just saying, if it turns out that a large percentage of folks who've been exposed, that's going to mean that we're well on our way to getting towards herd immunity in our response to this virus. And that would be a very positive sign. It's also going to mean, and this is really important for everyone to understand, if a lot more people have been exposed, it's going to mean that our fatality rate and our hospitalization rates are going to go way down, because those cases never got into our system because they didn't require hospital care. They didn't produce a fatality. So those rates, people are very worried that the fatality rate of the coronavirus could be as high as 3%, because we don't know how many people have actually been infected with the virus. If we have a lot of infections and not a lot of fatalities, the fatality rate is going to come way down. So that's really important. And this is going to come out in the data over the next few weeks as these groups publish their testing results. And then lastly, Bill, you asked, so I'm going to answer. So how does it actually end? How do we get out of phase 2 and into the end?
Yeah.
I think it's one of two ways, and I think epidemiologists would agree with me on this. We acquire herd immunity, which is painful because it means people have to get infected. People are going to get sick. But once we reach a saturation point, the virus essentially has run its course. It requires a fairly large number of people being infected in order to achieve herd immunity. The second is a vaccine. And I'm hopeful, like everyone, that the amazing, biological pharmaceutical community in the United States is going to produce a vaccine sooner rather than later. But that's how it ends.
Okay. Sorry, I'm reading through some Facebook questions that were just handed to me, and they're too small for me to read. I'll get back to them.
I'm sure you've got plenty anyway from the last couple of years.
I saw them on my screen. They're all really good. Again, I'm not a professional at this. The first time for everything. Sort of related, one of our readers, Eileen Schuler, asks, when widespread and significant testing, or when will, let me start over. Eileen Schuler has asked, when will widespread and significant testing be available in Santa Barbara? Do you know? And then Sharon Durlam, who's an old friend and a former colleague of mine, is interested in knowing whether there are unofficial records tracking whether people who wanted to get tested but who didn't meet the requirement were tested. I'm not sure that we know the answers to that, that you and I know the answers to that, but what are your thoughts on that?
I would say first that these are the questions that, of course, the media can and should be asking, right? So that we can get answers from our elected officials and public health professionals. Secondly, the future of testing at this point, I would say, is uncertain, given that we're already weeks and weeks into the pandemic. And whether we're going to see widespread testing or very carefully developed random testing, I think remains to be seen. I suspect we're going to end up more in the random sampling posture, where leading medical, organizations, hospitals, schools, universities are conducting random sample testing to determine infection rates and antibody rates, and then providing that information to policymakers so that they can assess what's likely happening with the virus in terms of its spread and the acquisition of herd immunity. And those sample sizes do not have to be enormously large to be very predictive from a statistical standpoint. So I suspect, given how far we are along, that's where we're going to go.
Interesting. Which also raises privacy concerns. So I wonder how that's going to play into it.
Yeah, I mean, these are important questions. How do you design the random sample? How do you make sure it fits those design parameters? Who gets access to the data? How do you anonymize the data? All those things. Those are important questions.
Yeah. Fact-based and transparent public information is crucial in a crisis, as we've been discussing. How have elected officials and public health officials risen to this challenge, in your opinion?
Oof. Let me first say that I have a fair degree of empathy and sympathy, if you will, for our elected officials and public health officials as they go through this crisis. As I said earlier, my first day on the job in the Treasury Department was September 13th, 2001. that was a crisis. And I understand the challenges of getting accurate data during a crisis and then reporting it correctly and without sort of either unnecessarily alarmist rhetoric or unnecessarily and artificially rose-colored glasses styled rhetoric, right? These are challenges and you're not always going to get it right on your first try. So let me be clear about that. But having said that, I don't think that history is going to judge the public communications on this coming from any level of government to have been particularly crisp or precise, given the actual data that's been collected and now analyzed. So I think there was clearly room for improvement in this regard. And hopefully, as we've now exited sort of this crisis phase, we will see improvements and a steadier hand in this area. Two things though, Bill, that do stand out for me as we have a few minutes left. One, I'm not sure why our government is unwilling to acknowledge its success. I've been wondering about this for 5 to 7 days. The stay-at-home order has been a smashing success, and the state government seems unwilling to acknowledge this.
Actually, we're going to come back to that as soon as you finish that thought.
All right. And then secondly is this question that I think the media is starting, not Noozhawk, but the larger media is starting to fan a little bit, which is what I call the moving goalposts problem. So we started this unprecedented journey together to preserve healthcare capacity, and we've done it.
Mm-hmm.
But now there's a sort of sense that we need to keep doing it because we're going to eradicate the virus, that this extraordinary effort is going to eradicate the virus. And I simply don't believe, one, that wasn't the purpose. And two, I don't think a stay-at-home order as it's written is capable of doing that. So by pointing to that as the objective, we're sort of confusing the public again a little bit. And I think the media and the government need to be clearer that we're moving from save our healthcare system, phase one, to living with the virus, phase two. And that's where we are. We're going to live with this virus, and we need to be clear about that.
Well, I don't know if he texted you too, but our friend Jim Youngson just texted me that Governor Newsom just said that Washington, Oregon, and California will be releasing a plan to reopen tomorrow. Obviously, that'll be a phased plan. We're not going to, as you said, we're not going to go back to things that what we were doing 6 months ago, but that's good news.
Yeah, that's extraordinary news, and that's certainly a case of better late than never. So sure. I'm really glad that that's happening. I think the East Coast, Mid-Atlantic, Northeast governors announced something similar earlier, right as you and I were getting on.
Oh, really?
But that would be real progress, and I'll look forward to seeing what that plan is and what the timeline is associated with transitioning into that phase.
Okay. Let me just back up because our managing editor, Gianna Magnoli, was talking just now to County Public Health Department. And she says that they told her that the department is not tracking people who have been denied tests. There's probably really no way to track that. And they have no plans for widespread testing locally. They can test more and get results faster, but they're still only going to be doing that for priority people, which is the population that is severely ill, has healthcare people and first responders. So that's good news.
That's great news in terms of what the governor has said, and quite frankly, given the pace, if you will, of the virus in Santa Barbara County, I'm pretty confident that whatever room we have to maneuver under the state order that comes down, we'll be able to do a good job of surveilling the virus in this county, even if we don't do widespread testing.
So I think we're going to, given what California is planning to do, I think we'll skip over this next section in our outline and go to that. A lot of readers, and I mean a lot of our readers, have wanted to know about a potential second bump. Chris, who didn't give a last name, asked whether it's possible to forecast a second wave.
Yeah, so I think we need to be very careful about vocabulary here. And I've been very critical of media reporting that uses words like bumps, surge, spike, explode, that kind of stuff.
Duly noted.
And you guys are not in that category, but I've been very critical of that. So let's talk about what's likely to happen. There's sort of two scenarios that are being bandied about. I talked about this a little bit earlier. One is we go back to life as if we're in December, go back to December 2019. That would be a terrible idea. We know with absolute certainty that there would be a major surge in coronavirus cases in less than several weeks.
Yeah.
And it would be very strong, and it would be very high, and it would recreate the conditions under which we would be concerned about overwhelming our healthcare capacity. So no serious person, and I'm sure the governor tomorrow is not going to announce any plan that reflects life as it was on December of 2019. So what are we really looking at? If we're going to live with the virus, we're going to look at ongoing coronavirus cases and hospitalizations in our community. That's going to be a fact of life. But the number, the trend line, the acceleration curve, if you will, on this stuff is not going to be very high. If we design our public health measures correctly, monitor correctly, and then course correct if something goes awry. And so, yes, I think we can model this. Yes, I'm confident we can design public health measures that will keep the cases and the hospitalizations to a healthcare capacity wise to a very acceptable level going forward, especially if we roll this out over time. And it's important to recognize, I think I mentioned this earlier, but my analysis of the March 9th to March 19th data, so the pre-stay-at-home order measures, shows that we were already doing a very good job of flattening the curve. And I'm guessing we're going to design measures that are more precise and more effective than the ones we were experimenting with in early March, because we know a lot more now than we did then. So I am confident that we can do this, and our public health professionals, with the support of our elected officials, can do this too, that we can get into a second phase and we're going to be fine. As a community, we're going to be fine.
That's great. Have you written or had any contact with government officials on any of these matters? And what's been the reaction if you have?
Oh, that's a loaded question, Bill.
I know the answer.
Let me, so the answer is yes. I wrote my elected officials and at the local and state level, so all the way up to the governor, twice. I wrote on March 23rd, and I wrote again on March 27th. And those letters are matters of public record at the Board of Supervisors. They are in the hearing records for hearings that were held around those times. In those letters, I detailed my concerns about the state's modeling and its lack of transparency. And I also indicated that I thought we were going to end up at about 6,000 hospital beds and we'd know the answer by April 6th. So I encouraged everyone to begin planning for success in late March. Let me say this politely. I received two responses. One from Das Williams, my supervisor, your supervisor, and the other from Peter Adam, our supervisor at the for the 4th District in Santa Barbara County. And it's probably no coincidence that those are the two supervisors who've been most active in pushing the county to begin thinking about the next phase. Beyond that, I've not heard from anyone.
Well, we did get a shout out from the Board of Supervisors today, from what I understand. So,
well, that would be great. And that would mean that the reasons you and I are in this together are coming true, right? This is all about civic engagement, and that's terrific if true.
What's your takeaway on the government's use of models to date? I mean, this whole conversation has been critical of them, but there's a role for those models to play. What do they need to do better? Because this is going to happen again.
I mean, that's a great question, Bill. And I think that what this has shown is that government at all levels, and I mean all levels, top down, needs to have a better internal capacity for data analysis in-house. We just don't have it, I don't think. And if we do have it, it's not in the right places. So we need to strengthen our in-house, inside the government data analysis capabilities. I think secondly, on things that are not in the national security, intelligence, law enforcement world, models should be subjected to public peer review in some fashion. I mean, you don't have to put a page up and say, here's my model, but we should be reaching out to, we have some of the leading epidemiologists, statisticians in the world, in one of the finest university systems in the world, plus some amazing private universities, all here in California. We need to take advantage of that in a way that we haven't so far in this crisis. And then lastly, I would say that our government needs to understand that there are going to be times when its internal capacity is insufficient to meet the challenge. And in those circumstances, it's appropriate, and I would say a best practice, to supplement your expertise with outside expertise.
Right.
And I think we're going to need to do that going forward if we want to be more adroit in understanding and responding to the data that we're getting as a government.
Fair enough. And on the data analysis front, I got to put in a plug. I'm on the board of the Westmont College Foundation, and I got to put in a plug for Westmont's data analysis major, which I think is 2 years old now. And it's a tremendous program, and what they're doing and how they're preparing those students is really a phenomenal benefit to, to the community, for businesses, for government. So hopefully there'll be a greater focus on that as we go forward.
I think that's great. We need more data scientists. But back to what I said earlier, their work needs to be informed by the context
Yes.
that they're working in and a real understanding of the problem they're trying to solve. I've encountered a lot of data scientists in my life who think every problem is nothing more than ones and zeros. And that's not true.
Wait, that sounds like our CPA. So what's next? Where do we go from here, and how can we incorporate the public health modeling into the broader picture of getting our community and the country, of course, back to work?
So I think we've got to get into phase 2, Bill. And as I've said earlier, I think it sounds like the government has been doing this, but the key to getting there is to look at the data we've already seen, make some assessments about what level of public health protection we can achieve with different social distancing measures, and then put those analyses into practice, and then monitor very carefully what's happening in the healthcare system to make sure that we haven't had a miscalculation of some significant impact, and get on with our return to our transition to the new normal, which, as you and I've discussed previously on many occasions, is going to look like pretty significant social distancing, probably tailored to certain demographics.
Yeah.
Wouldn't be shocked if we're all wearing masks when we go to the grocery store and pharmacies and shop at the Gap or Old Navy or whatever for the foreseeable future. But we should be able to go shopping eventually in the not too distant future, and things like that. And I don't know what the governor is going to say tomorrow, but for your readers who are super well informed, I would encourage them to follow what's going on in Austria, which has already started transitioning to the new normal. Their experience is very similar to California's. They have achieved enormous reductions in the virus trajectory through their social distancing. And they're the farthest along in moving into the next phase, and confident. They're very confident. They've already planned to reopen their schools on May 15th.
Oh, wow.
So we should all be watching Austria.
Oh, that's great. Well, Brian, on behalf of Noozhawk's audience, I really can't thank you enough for your time and expertise. This has been really informative to me. I believe it's been informative to our readers. We'll find out soon enough. I had fun chatting with you, and I think we should do this again. Would love to.
Yeah, I don't think this is going away, so I'm sure there'll be an opportunity to. I would say thank you as well, Bill, for the opportunity not only to participate today, but you've been an early and very strong supporter of getting the word out through my columns. And I'm very grateful to you for having done that. I think,
you're welcome.
Not to take a little bit of a victory lap, but I think you've earned it. So I'm going to give it to you. Not clear to me the governor's announcement would be coming out tomorrow, but for some of the work that's been going on here, quite frankly. So I think that's an enormous service to our state and our community to be so on top of this from the beginning and really focus on the critical questions that we needed to ask and answer. So I think Noozhawk deserves enormous credit for being on the leading edge of this charge to get us towards phase 2. And I'm really happy to have been part of that because, as you know, I mean, that's what I started with, which was civic engagement, and
yeah,
it's been terrific.
Well, thank you, and I'll be watching for Governor Newsom to do a shout out to Noozhawk tomorrow. So, if you're watching, Governor. Anyway, to our readers and I guess listeners and viewers, now that we're multimedia, despite my worst efforts, I want to thank you for your time and for your enthusiastic participation. And please give us your feedback. I'd love to do this again, but I need you to help me shape it. You can email your ideas to news@noozhawk.com, and I'm gonna put up a screen in a moment that has some email addresses and web links for it. But equally important, our elected officials and policymakers need to hear from you. The coronavirus crisis is a defining moment in the history of our community, and we all bear the responsibility to ensure that we're creating an atmosphere that protects the public health as well as our individual liberties. They are not mutually exclusive, and they must occur simultaneously. So thank you again for your time and for your support of Noozhawk. To quote Brian in his sign-off, be safe, stay healthy. Thank you.
Thanks, everybody. Thanks, Bill. Really appreciate it.
All right. See you guys later. I can't find that. Well, I can't find that. I can't find that thing. So I'm just going to sign off. Thank you very much.